Hi, everyone. This is Kim Aaliyah, and it is my great pleasure to introduce Dr. Joe Kellerstein for a 1-hour session on the use of collapse remedies in homeopathic practice. For those of you who had the opportunity to study with Dr. Kellerstein in the past, you know what an incredible scholar and erudite practitioner Dr. Kellerstein is, and how incredibly competent he is at being able to express and explain very difficult ideas in homeopathic practice. I probably shared this story before, but I think it's worth repeating again. Uh, Many years ago, I was actually in Toronto, and I was at a clinic. Dr. Kellerstein was practicing. It was a day where they were doing follow-ups, and the first patient came in, and Dr. Kellerstein said, "How are you doing?" And the person said, "I am doing so much better, just on all levels. I feel fantastic, physically, mentally, emotionally." And of course, we all have cases like that in our practice. And I said, "Yeah, that's great, you know." And then the second patient came in, and similar story, third, fourth, fifth, and pretty much all of the follow-ups during that day were pretty much the same thing, with just one success story after another. But what even impressed me more than that was the fact that his students in the classroom understood exactly why these remedies were given. They understood what exactly was happening with the case management and follow-up of each of the different patients. It was so impressive to me. And from that day on, I have become an incredible fan of Dr. Kellerstein. If you've never studied with him before, I can't tell you how invaluable such time is. For those of you who have studied with him, who had the opportunity to take his case-taking course or any of the other offerings he's made through Whole Health, now you know exactly what I'm talking about. So it's, again, my great pleasure to introduce Dr. Joseph Kellerstein. Been practicing now for how many years, Joe?
Oh, let's not discuss that aspect. It's over
Many
30.
years. I think
Many, many, many.
he started in the early 19th century, and anyway, so he's a real gift to the entire homeopathic community, and it's again with my great pleasure to introduce him for this class. I did want to mention that the early bird special for his course, the first aid course, will be expiring tomorrow. So if you want to take advantage of the early bird, you should definitely sign up either tonight or tomorrow. It seems that the wholehealthnow.com website seems to be down right now. We just went there and we weren't able to access the course, but you can go to whncourses.com, and then if you just go to whncourses.com and you scroll down a little bit, you'll see a banner that says Homeopathic First Aid, and if you click on the banner or you click here, you'll go to the page where you can go ahead and actually register for that class. You click over here where it says here, and then you can just type in your name and all the relevant information. So again, thank you for participating in tonight's session. I'm going to pass it over to Dr. Kellerstein. I want to also thank Hart Matthews for moderating tonight's call. And Joe, thank you again for all that you do for homeopathy.
And Kim, thank you for what you do for homeopathy, and in particular for this opportunity. Let me just click
My
on this
pleasure.
so I can be the presenter. Hart, let me know when my screen is presenting.
I can see it.
Perfect. Excellent. So let's get rolling on this. Let me just grab some water. Welcome, everybody. What a pleasure it is to be able to speak and hopefully to get some really good and interesting feedback. Feedback and questions are what make a course tick. I think, as you all know, we all have to make it a living organism, not just me bellowing here, but you communicating your needs and hopefully me responding to those. So the topic for this webinar series is first aid. And it's something that's very near and dear to my heart. And let me tell you why. When I first opened my practice in about 1981, which I guess does date me immediately, things were very slow at first. And despite my great love of homeopathy and my incredible enthusiasm with the successes that I would get, patients initially were slow in coming. It was difficult for people to warm up to a homeopathic practice. I mean, the principles are a little difficult to understand, to truly digest, and it's hard to develop trust. And that really was my first focus. How could a patient population develop trust that what I was doing was not only legitimate, but incredibly valuable to them, their families, their futures, all of their futures? it was certainly my honest belief, but how could I legitimately and successfully transmit that feeling? And my solution to the problem was something that homeopathic practitioners had done down through the ages, and that was to present first aid courses to a presumptive patient population. Teach them how to do simple things. Teach them how to do arnica, maybe belladonna, maybe rust tox, maybe 5 or 6 remedies that they'll use. Maybe do that a few times a year. Do it in the summer for hay fever season or for athletic injuries. Do it in the winter for colds and flus or other particular issues. If you can set up a first aid program salient to the needs of your patient population, have them become successful prescribers in their own right with these smaller issues, then they will automatically seek your help with issues that are a bit larger because they see the results. They don't have to be convinced. They know. That's the kind of success that I'm talking about, one founded on the instinctive trust of your patients. And first aid will do that. A knowledge of first aid will do that. The flip side of that is the more successful we are with our clients in off-the-cuff first aid prescribing, the more your reputation will spread quickly, and the efficacy of your prescribing will spread through the patient population, because it's first aid prescribing that is often the most dramatic and immediate in its result, and the most decidedly without questionability. I mean, it's clear it's working. So with that kind of conceptual framework in mind, let's get going on this. So as with any homeopathic endeavor, the very first thing we think of is the organon. The organon is the foundation of our studying, of our methodology. And in here I just want to briefly go through a few of the aphorisms in the organon just to establish a framework. Don't worry, I'm not going to turn this into another organon course, which is extremely long-winded, but I kind of want to make a point. So let's just go through a bit so that I can establish the groundwork for how I'd like to see things. First, aphorism 3. If the physician clearly perceives what is to be cured in diseases, that is to say, in every individual case of disease, in brackets, knowledge of the disease, the indicators in the disease, if he clearly perceives what is curative in medicines, that is to say, in each individual medicine, knowledge of medicinal powers, and if he knows how to adapt according to clearly defined principles, what is curative in medicines, to what he has discovered to be undoubtedly morbid in the patient, so that recovery must ensue. I'm going to stop there. That's what we really need to focus on in this course. We're looking at what are the disease indicators? What are the absolutely reliable morbid shifts in this patient's state? Secondly, what are the indicators in the remedies that absolutely tell us that this will be a medicine that can advance the healing ability of this client in this situation? That's what I want to focus on. The answer to both of those are symptoms. What are the clear symptoms of this patient in this first aid situation that have the capability to act as indicators to a remedy? Secondly, what are the clear and unique indicators of each remedy that undoubtedly indicate that when those symptoms are present, this medicine will move the vitality in a healing direction? That's what we want. Let's move on to the next point. Aphorism 71. As it is no longer a matter of doubt that the diseases of mankind consist merely of groups of certain symptoms and may be annihilated and transformed into health by medicinal substances, but only by such as are capable of artificially producing similar morbid symptoms. Again, remember he said morbid, undoubtedly diseased, groups of certain symptoms. So again, it becomes our task to discern certain symptoms, symptom being defined as that which is undoubtedly diseased, undoubtedly different from the patient's healthy normal state, and undoubtedly indicative of a remedy known in our materia medica. That's what we're after. Aphorism 71. It's all about groups of certain symptoms. Good. Next. Aphorism 18.
Dr. Kellerstein?
Yes, Hart.
Dr. Kellerstein?
Yes.
I'm sorry to interrupt. We have some folks who are having difficulty hearing.
Oh.
Can you just...
Let's check, let's go back and check which, my system preferences?
Oh, no, I think just maybe speaking louder. Or I don't know, is the microphone on your headset relatively near your mouth?
Very close. Let's check my system preferences just to see. So I've got my Logitech headset going, and yeah, it's all set to my Logitech. Let me try a different USB port.
Yeah, and we have other people saying that they hear just fine. So I think there was a short space where you were speaking a little bit more quietly, and I think some people are just having some volume issues.
Okay.
Don't worry. You don't need to worry about that. I have a backup recording going.
Okay. Let's get that going anyway. Okay. How's the sound quality?
I think it's excellent.
Okay. So Aphorism 18. Aphorism 18 is an extremely important point in both acute and chronic prescribing. If we look at the end notes that Hahnemann had, and we can look at those very clearly in Wenda Brewster O'Reilly's version of the Organon, where it's nicely set out after the body of the Organon text. But here is the full text of the aphorism. It says, "From this indubitable truth that besides the totality of symptoms, with the consideration of accompanying modalities, nothing can by any means be discovered in disease wherewith they could express their need of aid. It follows undeniably that the sum of all symptoms and conditions in each individual case of disease must be the sole indication, the sole guide to direct us in the choice of a remedy." In the end note, Hahnemann tells us very simply, the totality of symptoms is the only guide to direct us to the choice of a remedy. So again, groups of symptoms, symptoms which are undoubtedly morbid. That totality is always our sole guide. Aphorism 153. I won't go through it. That's a long lecture in itself. But it essentially means that of the symptoms available to us in the totality, the ones that most uniquely point to one small ones that we need to look to, attention to. And you'll see that group and graph the elements so as to be able to see visibly a unique totality. You'll see that with each of the 6 remedies we discussed. And we'll see how its peculiarity functions as it hits the road. From the introduction to the 2nd edition of the Organon, Hahnemann tells us that it's experience alone that can teach us adequately. basically, from here, we learn that if we take a single step, just a last sentence here, that its subjects, meaning knowledge of the disease to be treated, its subject can only be derived from pure experience and observation, and it dares not take a single step out of the sphere of pure, well-observed experiment and experience, if it will avoid becoming a nullity, a farce. The idea here is that symptoms are us. Homeopathy is unique amongst all medicines in that it is virtually the only medicine where the structure of symptomatology purely points us to a remedy without having reference to any other paradigm of thought. You know, in Chinese medicine, we interpret the symptoms into excess yin, excess yang, symptoms of this organ, symptoms of that organ. And then we interpret what we need to do to the patient. In homeopathy, it is the pure language of suffering that directly guides us to the curative remedy. And this is really beautifully described in an article by Anton Rohrer on the certainty of homeopathic prescribing. So with that little bit of a preamble, let's get rolling. The topic for today, as you know, is collapse. Now, collapse is often stroke. These could be considered stroke remedies, but in essence, they are remedies for collapse. The first remedy is opium. Opium, undoubtedly the most famous medicine of all, the most used medicine of all. When Bayer introduced one of its flagship drugs that they called heroin, it really became popular. Opium as a homeopathic remedy is fantastically complex, but I want to keep it to the very simple, very obvious, and most usable symptomatology. Here's a picture of a green opium pod, so not quite ripe. What they do is they scarify the pod in order to get the sap, the milk, to come out. They allow that milk to dry, and from this dried milk, of course, they make the drug itself. This is Dewey talking about the materia medica, the homeopathic, not the drug, but the homeopathic materia medica of opium. The remedy most undoubtedly similar to the general symptoms of apoplexy. And now apoplexy simply is an older term for stroke. The remedy undoubtedly most similar to the general symptoms of apoplexy is opium. The paroxysms, the attacks, are preceded by a kind of dullness of the sense. You'll see later that one of the chief symptoms of opium, the whole nature of most of its symptomatologies revolve around this senselessness, this dullness. So the paroxysms, meaning the attacks of pathology, are preceded by dullness, vertigo, which is dizziness, heaviness of the head, buzzing in the ears, hardness of hearing, a staring look, sleeplessness, anxious dreams, or a frequent desire to sleep. It has that dichotomy. It can go either way there. This is from Dewey. No remedy produces such a profound stupor, and it is expressed in our materia medica as follows: a stupid, comatose sleep with rattling, stertorous breathing. Dullness, senselessness, the whole idea, or one of the great ideas behind opium, is this inability to respond because you're dull, because you're senseless, and you just don't care. So stertorous means snoring. That's all it means. And stupor means sleepiness. So a kind of dull, stupid sleepiness with a deep snoring, rattling, breathing. These are keys to the materia medica of opium, especially in an acute state. Now here we have a fellow who looks as if he's had a really good time and smoked a bit too much of not cigarettes. And you can see the kind of dullness is indicated by the appearance on the face. He looks like he belongs in a Dumb and Dumber movie. But look at, just get an idea of that look, that dullness, that stupid dullness. Now let's combine it with a few other elements of materia medica. This guy who is not allowing his wife to sleep at all, this is the stertorous part, this is the snoring. Now imagine that, somebody snoring like a freight train. And it can be of a highly irregular rhythm. So it's that most irritating kind of snoring that absolutely would not let you get back to sleep. Any of you who've had loved ones in a coma, or perhaps who've had a stroke, and even on towards the final stages of life, will have heard that horrible, awful, rattling breathing, the death rattle, as it's called under carbo-veg. But snoring, so important. I have to tell you a story about a patient, a chiropractic patient of mine. One day, one of my one of my patients failed to show up for her regular scheduled appointment. Let's call her Mary. Mary was in her mid-70s, I believe. And Mary always absolutely came on time. And my secretary, Wanda, who is an absolute sweetheart and loves old folks, just was incredibly afraid for this lady because she had always come on time. She knew that Mary lived alone. Well, ultimately, I convinced Wanda that if she was that convinced of her own hypothesis, she needs to call police. The worst that would happen is this very small embarrassment, but all towards the good. So we did call the police. The police did break down her door. Mary had been lying on the floor after a stroke for a couple of days. She was taken. She was not expected to live. We got a phone call as I was doing chiropractic treatments on patients. Mary's sister said to Wanda, she's not expected to live rather, and the only thing she could say is she's lying there in a coma, her eyes are half open, her face is a deep red, and all she's doing is snoring up a storm with a very irregular breathing. Well, you know what we got her. It was this remedy in a 30. And I asked her sister to put some in water and just moisten her lips with it about every 20 minutes. Well, it wasn't long before we got the call. Mary woke up after a few doses. A day or two later, we got the call from her sister again. And I got just a few symptoms, and I don't want to go into the next phase of things because there were a few follow-up remedies. But needless to say, about a month later, while I was treating people chiropractically in my office, I had a knock at my treatment room door, and there stood Mary. And Mary just wanted to give me a big hug for saving her life. It was actually Wanda who saved her life. But just with a few keynotes of materia medica, imagine what you might be able to do, okay? This just moves me incredibly still to this day. Anyway, in addition to this, opium has a dark red flushed face. And according to Dewey, the darker the face, the better the indication for opium. A marked venous congestion is actually a more valuable symptom than the profoundness of the stupor, of the sleepiness. So let's get a peek at what that might look like. Here's a red face. There's something with a lot of venous congestion. I hope you can see that quite clearly. I just want you to get that skin tone. To me, that or even a bit more red could be the skin tone of opium. The deeper it is, the better the indicator. In addition to this bloated face, the eyes are bloodshot, half open, and the skin covered with a kind of a hot sweat. It's said that in opium, all of the secretions are turned off, except for the sweat. The throat is dry, stomach is dry, all the way down, but there's a warm sweat. Here's the eyes half open, bloodshot, and you can see the kind of stupor, as if somebody were utterly stoned or drunk. Good. Let's keep going. But add to this that the pupils initially in opium will dilate, but then they'll become pinpoint. And there's no response to light, touch, noise, anything else. Anything else, of course, except the indicated remedy, which is opium. Look at that pinpoint pupil, the red eyes. Now, of course, this eye is being lifted open for examination purposes. But that's what a pinpoint pupil would look like. The lower jaw drops, just like somebody's snoring. The pulse is slow and full, not slow and weak, not slow and easily compressible, but slow and full. Okay? Also, with opium, we see abnormal painlessness. The painlessness of things that are normally very painful. Now, again, this goes with a general idea of opium, which is a dullness, a senselessness, a lack of reactivity. That's what the drug does. Okay. Just to give you the idea, imagine this was you. The painlessness of things which might normally be painful. All right. Does anybody know where that rubric is, by the way? If you do, just let Heart know. If not, we'll go over it in just a moment. Now, opium, besides the dullness and the senselessness, has this exaltation of the sensorium and a suspension of the mind, so that a suspension of the mental faculties, so that the mind, the rest of the mind, can just run rampant. In opium, we have this incredible propensity towards fright. Now, here's a lady doing a fantastic job of showing the archetypal Fright Night movie, Shriek. This just gives an incredibly great idea of the intensity of fright that opium can experience. You'll see it in the rubric, Ailments from Fright. The fear of the fright remains. Just soak up that idea. So we have the stupidity, we have the painlessness, we have the coloration of the face, the snoring, the fright, the pinpoint pupils. All right, we're putting together the pieces. Sleepy, but cannot sleep. Their hearing is exalted. Again, the hot skin with warm perspiration. The diminution of all secretions except sweat. And a little extra bonus, the bed feels so hot they can't lie there. They have to jump around and find a cool place. Like what other remedies? If you know, mail it into Heart. Okay? And they have to be uncovered. Like what other remedies? Which remedies are so hot in bed that they would uncover? Now, unfortunately, in this Word doc, and if somebody can help me out, that would be great, but I kept trying to cut and paste, and it just kept, the size of the graph is just a bit too tiny. So let's go back to the original graph in my version of MacWrap. Okay. Here's my opium graph for this course. Let's actually change the presentation from colors. I just happen to prefer the colors to the numbers. And the size of this should be okay. Heart, is this visible?
Yes, it's quite large.
Good, 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 good. So we can see here, here's what I mean by a totality of symptoms creating a uniqueness. You'll see that just by putting in this combination of symptoms, I didn't weight anything or do anything to make opium turn out first. I only inserted the key symptoms, and it naturally comes out. And you can see that opium is the only remedy with all of these symptoms, and you see the remedies that come out close to it and why. You can see, for example, that gelsemium is very similar to opium, but it doesn't have the stupor with the dropping jaw. It doesn't have the painlessness. And it doesn't have the stertorous breathing with the unconsciousness. And those are principal differences in this genius relative to the other. And you can see the difference with stramonium. Stramonium doesn't much have the strongly red face, doesn't have the stupor with the dropped jaw, and it doesn't have as much the stertorous breathing with the unconscious aspect, okay? Nor does it have the hardness of the bed, and we'll go into the heat of the bed in a minute. Did I not include that? Oh, I guess I didn't. Where would I find that rubric? Where is it that you would find the rubric in the repertory when people say, I keep moving around, having to find a cool place in bed? Can anybody tell me? So, Hart, do we have any answers for any of those questions?
We do. Let's see. So going back a little bit, generalities, painlessness of complaints usually painful.
Right.
We had a number of people get that one.
Right there.
Indeed. And we have some guesses at remedies that might be searching for a cool spot in bed. Sulfur.
Okay, very good.
Lachesis.
We'll see.
And let's see, we have a couple of rubric suggestions. Gene suggests camphor.
Okay.
And we also have a Nux. And then let's see, sleeplessness, bed feels too hot.
Those are good shots. But here's a specific rubric, I think, right here. Let's go back a stage. First of all, we're in generalities. Secondly, there's a rubric, heated becoming aggravates. That's the meaning of the rubric. That's where someone becoming warm internally aggravates the condition or the person. There's a sub-rubric in bed. And a sub-rubric, again, seeks a cool place. 11 remedies. You'll see that in this particular rubric, we have pulsatilla and sulfur and opium quite conspicuously. No lachesis, although it was a good guess. If we go up to the next one, still not quite any lachesis, although certainly in the general sense, lachesis is definitely there on becoming heated, but not known for seeking a cool place in bed. I just wanted to show you that because when a patient says that, and if it's a very, very firm symptom, you'll want to go straight to that particular rubric. It's a very good differentiating rubric. Good.
Joe, would you like a quick question about opium that came up earlier?
Sure.
Is it possible to recognize the red complexion, the dark red complexion, if the patient is not Caucasian?
No, no, I don't think so. But you might recognize the heat in the face, and the warm perspiration. No, I think that would be quite difficult. You will notice the redness of the conjunctiva. You will notice the stuporous appearance. You will notice the snoring, but no, of course not. That's a very good observation, yes. Good. Let's go back. Let's take a case. We don't have time to do all of them, but you know the Word doc will be available to you. And the reason I did a Word doc as opposed to a Keynote document or a PowerPoint document was simply because we had so much text that I wanted to let the text flow, and I just thought this would be better. Now, let's go to a case. I wanted to demonstrate that studying Materia Medica, in the study of Materia Medica, studying symptoms from our old literature is absolutely vital. The flavor that it gives us, the chewiness to the remedy, the distinction to the remedy is unbelievable. And I'm just going to let the case speak for itself. So case number one is a case from Dr. Carlton Smith. Before I studied medicine, I stood at the bedside of a young lady suffering with the most horrible puerperal convulsions. What's a puerperal convulsion? Can anybody tell me? Any answers coming up?
Yeah, post-delivery, post-labor,
Yeah.
postpartum.
So it's the postpartum phase. Puerperal convulsions will be convulsions occurring after delivery, and often they'll occur with some sort of systemic infection that the patient is suffering. So anyway, stood at the bedside of a young lady suffering the most horrible puerperal convulsions. Dr. Constantine Herring, we all know him, was summoned to the case. I love this. It's like an old movie. He came into the room in his usual style, and those who are intimate with the grand old man know what I mean by that. Dr. Dillingham, doctor, won't you describe that style for the benefit of those who do not know him? So this is clearly a roundtable discussion. It's an IHA, International Hahnemannian Association discussion. Dr. Smith, well, he always entered the sick chamber in a sort of swinging, slouchy style, throwing his soft hat, which he always wore, and which was not very handsome, onto the first chair he came across and proceeded at once to the patient's couch. Had very little to say, rather reticent to those around, but always to the point. When he was obliged to address the attendants, he took the pulse of the patient the first thing. See, he took the pulse. Why would he take the pulse? I'll tell you why. Because a lot of remedies are differentiated by the pulse. Opium, as you just heard, has a slow, full pulse. Aconite, belladonna, a hard, bounding pulse, almost hammering your fingertip as you feel it. Gelsemium, a slow, compressible, weak pulse. Same with ferrum. He took the pulse of the patient the first thing, then watched her closely through those black, piercing eyes of his. And as he did so, another convulsion came on, more aggravated than the first. I stood by the bedside of the young woman to whom Dr. Herring had been summoned in great haste, the tongue being protruded between the teeth and the jaws locked, the face purple, and the breathing stertorous. The patient's teeth were all sound and strong, hence there was no way of conveying the medicine down her throat. At any rate, she was unconscious and couldn't swallow. Intently, I watched to see what the doctor would do in such an emergency. He soon diagnosed the case, and as quickly the remedy followed. Then from his little pocket case, he took out a tiny vial, so small I couldn't help noticing there was more cork than vial. And while he closed one nostril of the girl by pressure of a finger, he held the mouth of the uncorked vial closely to the open nostril. And by her natural breathing in the interval of the spasms, she inhaled a high potency of opium. In a few moments, these convulsions ceased and never returned. Now, come on, how are you ever going to learn that without that case? It's gorgeous. So here he did an olfaction of an alcohol-impregnated pellet, right? And he did it because there was no other way. And here you learned another possible symptom, that the tongue was protruded, but the jaws tightly clenched and immobile. Wow. So kind of a trismus of the jaw. So these are the kind of images that you fix in your mind to become a prescriber. Kent says that you fix images of the sick. That's why you learn materia medica. He said the best way to learn materia medica is with a hardback chair and an open book. And you make those images in your mind so that when you're introduced to the images of the sick people you see, it becomes automatic that your mind hunts for a similar image. That's materia medica. That's why I'm trying to teach it this way. So you have these images in words, you have these images in picture, you have the images in a graph. Now, we have 6 more cases or 5 more cases that we will not do for the sake of time, but they will be available in the document. I especially want to draw your attention to case 3 and the definition of what a full habit is when you see it in the old literature. Just something for you to search for. You can see we've got these cases. Let's move on to our next remedy. Okay. Arnica. Arnica needs no introduction. Remedy is obvious. We all know why we use it. Arnica is our remedy for bruising. The feeling is as if beaten. Especially useful in sudden injury which was unexpected, trauma to the muscle, heat in the head, coldness of the extremities. And let's look at more of the materia medica of arnica. Arnica is useful in so many situations. A collapsed state is one of them. Jack and Jill, our favorite arnica characters. Again, images are useful. Arnica is the remedy where there's soreness and aching, a kind of aching as if you've been beaten, as if you've worked too hard. The aching, the soreness can develop into a weakness, can develop into a paralysis. It is especially, interestingly, and this is not widely known, a left-sided paralysis. Again, a full, strong pulse. And stertorous breathing. Does that overlap with anything you just heard? Of course. With arnica, not only do we have a tendency towards easy bruising and the feeling of being bruised all over, bed sores will form rapidly. You know, the bed will feel too hard, right? And the bed will be too hard. The bed will engender these ecchymotic areas, these bruised areas that can further develop and ulcerate. So the bed sores will form rapidly. The bed feels too hard. We have heat in the head and the face, body and extremity cold. We have, again, the bruising. We have this stuporous symptom where the patient answers and then falls back into a stupor. I'm going to stop there for just a moment. Does anybody know where that symptom is in the repertory? Can anybody find that for me? In fact, I'm going to stop here until someone pretty well does. Where is that symptom in the repertory? Hart, let me know when anybody takes a shot at it.
We don't have a specific answer yet. You're looking for the entire rubric, I assume.
Well, there are several places where it is, but let's If there aren't any takers, we'll give some hints in a moment.
Well, we have some general guesses. Generalities, mind talking.
That's a good one.
Mind answer, stupor returns.
That's it. Excellent, excellent, excellent. Mind answers. Stupor returns quickly after. I want you to have a peek at this rubric. So this is the situation where somebody is in a coma. Somebody seems unconscious. You shake them and you say, "Hey, Joe, wake up." Or you talk to them. And they open their eyes and they go, "Yeah, what's going on?" And after they feel as if they've finished, they go back into a coma. Remember this symptom. I've actually saved a person's life twice with this one rubric. Take note of the remedies that are in bold. I found those clinically useful. Hyoscyamus is the remedy that I used most notably. Got incredible results with. Okay? Let's go back to the case. Stupor answers, then falls back into a stupor. Taste and eructations and stool all smell like rotten eggs. So your burps, your stool will sort of taste sulfuric like rotten eggs. Arnica, recent and remote affections from injuries, especially contusions or blows. So an ailment from injury, even if it was remote or seemingly innocuous. Okay? Hemorrhages, which are the result of mechanical injuries. Now, this brings to mind a case of an individual who gradually lost consciousness days after what seemed to be a fairly innocent hit on the head. Now, initially, the hit on the head could have looked as if it was serious. A lamp which had a very heavy metallic base fell and struck him on the head. But he said the pain, okay, so it hurt for a bit, it stunned him for a bit, but he seemed as if he could function quite normally and as if his body had thrown it off. But over the course of subsequent days, he became more and more weak and at some point just collapsed. And I got a very quick phone call, and after insisting they call an ambulance, I also told them that I knew they had some Arnica 200 at home and I wanted him to have it every 5 minutes. Before he got to the hospital, he did regain full consciousness and feel much better, but he had a slow bleed. Arnica was very, very helpful. Okay, so let's take a look at this graph. And again, it's too small. I don't know how to increase the size of it in my Word doc. So we're going to go back to MacWrap. And we're going to take a look at, no, not that. We're going to take a look at, okay. First aid Arnica. We'll go get that graph. Oops. There we go. Here's Arnica. Okay. Let's move it over a bit so it's a little clearer. So here's the rubric for stroke, apoplexy. Here's a rubric, apoplexy threatening, predisposition towards something to keep, a rubric to keep in mind for people who get recurring tendency to mini strokes or TIAs. Okay? Then the ailments from injuries, the difficulty thinking, the stupor, the heat in the head and coldness of the body, the eructations like spoiled eggs, the chill. I don't know how that got in there. Let's remove that. And of course, the sensation of the bed, the easy bruising. Again, you see, straight up, Arnica slides to the top of the list on the basis of its unique totality of symptoms. Arnica. The number of Arnica cases we have in the literature is truly prodigious. Here are a few cases for you. We don't have the time to do them here. An hour is a very short period of time. Here are a few cases. Go over them on your own. Work through them. That's a way to really get to know a remedy. These are some excellent cases. Next, it's belladonna. There's a belladonna berry. We don't want to be putting that in our mouths. We don't want to be using it in a stew of any kind, no matter how pretty it looks. It looks kind of like a pupil, doesn't it? Like a dilated pupil. And of course, that's what it's used for. And belladonna itself, the word meaning beautiful lady. Because ladies, in order to beautify themselves, use this to help their pupils grow to a large expanse, those big dark pupils just singing out of love and attraction. Okay, let's go for the materia medica on this. There's another angle. The idea of belladonna is that the belladonna patient, here's this great word, ebullition. What does that mean? Ebullition. You will see it in the old literature. Can anybody tell me what it means? Ebullition. Any takers out there, Hart?
Surging of blood.
A surging of blood. Let's see if we can get a good definition on dashboard.
We have plethora as well. Orgasm of blood.
Yeah, but how do we recognize it on the hoof? I mean, in a patient sitting in front of us. Ebullition, bubbling or boiling, just like it sounds, right? Ebullition. Blah, 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 blah. So a sudden outburst of emotion or violence, as in an ebullition, something bubbling up. And here it's blood, bubbling up of blood, okay? Agitation of bodily humors. Now, humor, don't forget, bodily humor, humor is only liquid. Humor just means liquid, in this case referring to internal liquids native to the body. So the boiling up, the bubbling up of blood, the humor. Nothing funny about it, but ebullition. So the belladonna patient presents a picture of ebullition. Yes, surges of blood, bubbling of blood, rushing of blood, suddenness. Just keep that picture in mind. There's an image of ebullition. Here are some other definitions. A seething or overflowing, as in a feeling of passion or outburst, right? The state of being ebullient, except that says ebullient. I can't say it that way. It just doesn't feel right. So again, bubbling up, rushing forth of water or of lava in a state of agitation. The face is fiery red. This initial bright red color might change to a dusky tint, so darker red, and the continents become mottled in appearance. So mottling would be red with some white in it, sort of a marbling of red and white. The appearance is like one of fury, as would be the case if aconitum was indicated. And here's a good idea of it. You'll notice this is a far more intense red than the dusky purple we saw in opium. This is definitely arterial. Okay? Here's what one author said: no remedy has more persistent, violent delirium than belladonna. So you get a fever with a patient in a kind of delirium, and it's very persistent. You get the red face right away. You've got to rule out belladonna. Doesn't mean it is belladonna. It means belladonna moves front and center, and it's your job as a homeopath to logically, on the basis of symptoms, rule it out. In that delirium, The patient will imagine that they see ghosts, that they see hideous faces, insects, black animals, dogs, and wolves. This black animal in a delirium or a dream even, especially if it's an animal, dog, wolf, is highly characteristic of a belladonna delirium. You can imagine the fear that might be involved here. Where the poor child sees these horrible faces, the ghosts, the black dogs, the animals, the wolves. Then we get the arterial aspect, a red, puffed face. Then just below the face, you look at the sides of the throat, and you see the area where the carotid arteries are. You see the throbbing, the boom, 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 and the heat. You may see spasms or twitching or jerks. You take their pulse, and it's booming. It's full. It's bounding. It is not slow. It is not compressible. And again, like arnica, the head is hot. The extremities are cold. Okay? That, in fact, is a very reliable indicator. Whenever you get a lot of heat and redness of the face, delirium, heat in the head, coldness of the extremities, you must consider belladonna. In fact, in any situation where you get a lot of heat in the head and coldness of the extremities, again, you're in a situation where you have to rule out belladonna. Okay. The head symptoms preponderate, meaning blood rushes to the head, and you'll see evidence of it. The pupils are huge, black, and staring, just like those belladonna berries you saw at the beginning. Okay? Characteristically, the symptoms manifest suddenly and are violent. Things that are slow, that come on over a few hours and feel like a gradual onset. It's the feeling of the patient that would count. The patient will tell you if it felt like it just came on, boom, or if it crept up on them. Belladonna is sudden and violent. We get the pulsations, the heat, the inflammation, the pain, and the mental disturbance, all sudden, all marked. Then we get this unique thing. We have the throbbing pains, but we have this timing aspect. And you'll see this a lot. You'll see this in children who are suffering an acute otitis media often, where the pain comes on suddenly, and it's intense, and it lasts for a few minutes, and then boom, it's gone, and there's an interval of pain-free. Then again, sudden, few minutes, pain-free. So it comes, it stays, it goes, all quickly. Belladonna headaches are worse stooping forward, bending, or lying down. Anything that takes the patient out of being straight up and down so that the throbbing, surging blood can more easily go from the heart straight to the head and make the person feel miserable. Worse lying down is a very reliable characteristic about most people. Most things are better lying down. When something is worse lying down, it's very reliable. The elder Lippe, this is again from a journal, the elder Lippe once told me of a case of suspicious enlargement or swelling and pain of the breast of long standing, which, as he expressed it, seemed likely to prove a case for the surgeon, cancer, which was entirely cured by a few doses of belladonna, to which he was guided by this symptom of the pain being so much worse on lying down. There is an aggravation from bright light, from any form of noise, and the least jolt or jar, as would be expected. Lying on the affected part aggravates the symptom, and this, of course, differentiates it from what remedy that is much better from lying on the affected part. You can email that to Hart. There is amelioration from warmth. A warm room, warm wraps by rest and the avoidance of movement. Also by bending the head backward. So that's a general symptom of belladonna. In collapse, we'll see all of this. The hot, bloated face, the dilated pupils. We can see nausea as well, the drowsiness, the stertorous breathing, again, just like arnica, just like opium. The grinding of the teeth. I wonder if those other remedies have that. And we have some other features here as well. Now, there's a graph of belladonna. Hard anybody answer that question?
Oh yeah, that one went quickly.
All right, I love to see it. I love you guys. That's the kind of game I like.
Yeah, Bryonia, they nailed it very quickly.
Excellent, excellent, excellent. That makes me feel good. All right, now let's see if I can open this. Oop, oh, I went right by. There we go.
Hey, Joe.
Yeah.
While you're looking around, we're getting a lot of questions about about your notes for the course, and I believe you mentioned earlier that people would have access to all of these cases, the ones that you weren't able to cover.
Yes, of course. So
do you want to post those separately, or are you going to just provide people with that Word doc?
So what we can do is, Hart, can I email those to you? You could just post it with the video?
You certainly could. In fact, at the end of the class, if you did that while we were going through questions, perhaps, I may be able to post it here for people to download tonight.
Sounds excellent, because looking at the clock, we don't have a lot of time left. So I'll try to make it through one more remedy, and then we'll get to some questions. So my time frame would be to finish the lecture in about 10 minutes.
Great.
Good. So, folks, here we've got a little graph of belladonna. And as you can see, here are the remedies that are very close to it. But look at the point spread. If I was a betting man, I mean, belladonna, and look at the repertorially indicated intensity of these symptoms. I mean, it looks like a belladonna case. It's all bright red. Well, except for the black here, but those could be the pupils, right? The belladonna berries. But here we have, look, belladonna, stramonium, plumbum, cicalia, aconitum, hyoscyamus, lachesis, things you'd expect. And here are some of the points of differentiation. And this is something you can study when you see a graph like this. What a great way of studying materia medica, seeing the differences between remedies, okay? And you know, the first place I ever saw something like this was Andre Sain had presented materia medica in this way. And wouldn't it be wonderful to have a bunch of remedies on hand with their graphs, so that if you were thinking a case in front of you was belladonna, you could just whip through the checklist and see if any of these keynotes were there. Or if you came up with different symptoms, you could bounce down to similar remedies and check those out while you were questioning the patient in front of you. Which is why, as you noticed, in my file, I have materia medica charts. So that if a patient is in front of me and I want to DD it, I will pull one of these out if I feel it's necessary. Hopefully, the case you've taken is uniquely indicative and will guide you directly to a remedy. And you'll read it and confirm it in materia medica. But these also help. Good. Let's move on. So here's some cases of belladonna. Good. Now, camphora. What an overlooked collapse remedy. Looks kind of like belladonna. Actually, it looks like blueberries, but it's not. So camphora, the tree, we have the berries. Camphora, known as a spice in the ancient world, known as a medicine in the ancient world, very penetrating, unusual odor. Fantastic remedy. But the key, forgetting all about any kind of intro to it, the key to camphora is this sudden and complete collapse of the vital force. Somebody, for no reason at all, in front of you goes down like a sack of bricks. Boom. Camphora, sudden and complete prostration, sudden and complete collapse, either with weakness or with unconsciousness. That's the first thing you say, okay, it happens with great force and suddenness. Then the whole surface of the body is cold. We have the two elements, the sudden and total collapse, the coldness of the surface. The surface is very cold to the touch. That means objectively cold. You see how this materia medica invites you to look, to touch, to observe. It invites you to physically examine the patient. Okay? So we have this contradictory aspect of camphora, which really tends to confirm the case right there. So initially, you'll have the sudden and complete collapse. Secondly, coldness of the surface of the body, but yet they cannot bear to have themselves covered. They throw off all coverings. Okay? And the entire body is very painful to the slightest touch. So it's the suddenness, along with the coldness, but aversion to covering, that puts you right into the ballpark of camphora. The other things serve to confirm. Let's keep going. There's a graph of camphora. Let's go to my copy of MacRap. And camphora, I really encourage people to study camphora even as a chronic remedy. The mental symptoms of camphora, of being isolated as if in a foreign world, it's surreal. It's totally surreal. I would invite you to study that materia medica just to see, to understand the depth of that a proving can go to in changing the physiology of a human being. So here we have the symptoms, ailments from shock, injuries, sudden collapse, okay, external chill, internal heat with external chill. It's that internal heat, that radiant internal heat, that makes them not want to be covered, because even though the surface feels objectively cold, internally they're on fire. They don't want any coverings. It's almost the way you feel when you put some Tiger Balm on, or some Vicks Vapo Rub, or anything containing camphor. You get this counter-irritant effect where you can feel cold on the outside and very hot on the inside. And that's why you don't want to be covered. So here's what the graph looks like. You can see that the suddenness, containing 9 remedies, the sudden collapse, then the internal heat with the external chill, and especially this symptom, cold and dry skin but wants to be uncovered. It's virtually unique to camphora. You see Cicale follows up real closely. Aconite has a lot of similarity. Then we go down to Veratrum, Arsenicum, Apis, Arnica. But uniquely different from opium, it's nowhere to be found. Belladonna is way down the list, trailing the pack. Let's see if opium's here at all. Hold on. There it is. Just in the sense that it has ailments from injuries, but none of the other similitude. Good. And in this way, we can gradually get to know a remedy and see how it's distinct from others. All right. It's 9:10. I was told I had a time limit or I was going to get strung up because I do tend to run on at the mouth. So, Hart, let's open the floor for questions.
Okay.
Now, Hart also...
I'm going to take this. Go ahead.
I just wanted to say, let's just put this in here as an email attachment, and I should send this to whom?
Go ahead and send it to me.
Whoops. Okay, let's try that again.
Okay.
There we go. We got it.
So I've taken the screen for just a moment here because I want to remind people of a couple of things. This is the Whole Health Now courses page. This is the one we're having a little bit of trouble with this evening. So you can see that if I roll down to Homeopathic First Aid and I click here, right now something's not coming up there. However, if you use this page instead, which is whncourses.com, this is what it looks like, and if you roll down, you will find a number of different classes. If you get to Homeopathic First Aid and click here to register, then you'll get to the registration page. So that's the way to get there. The early bird special does end tomorrow. It is currently at $200. And tomorrow is the last day there, so make sure to register tonight or first thing in the morning if you want to get into this one at the lower price. The course does start on July 29. You can see here the dates, 6 Wednesday nights. I believe it's 3 weeks, 4 weeks in a row, and then there's maybe a week off in there. Is that right, Joe?
Something like that, yes.
Yeah, okay. So in the meantime, have you sent the email, Joe?
I did.
Okay, so I'm going to give you back the screen and find some questions for you. Hang on just a second.
Whoops, I'm getting a bouncing ball here from go to meeting. Okay, show my screen.
There you go. You've got it back now.
Wonderful.
All right, so we have a number of questions that have rolled in here in the last few seconds. So going back a ways to opium, Francine was wondering if you were talking about the kind of the dropping of the jaw, right? And she's wondering if a dropping of one corner of the mouth would be classified as a dropping of the jaw, or is that something else?
It's more paralysis. You know, you would anticipate that side of the face was, but the dropping of the jaw would be a pretty visible dropping or drooping of the jaw. And in fact, there's a nice little, I believe there is a nice little rubric under face, just to show this. Well, we can't see, there's no photographs, but here's dropping of the jaw right here. So here's opium. No camphora. Belladonna is there. I think that's about it for what we've done tonight. Arnica as well, of course, right there. But the mouth has to appear open. Just a drooping corner, no. Here's another rubric immediately above, dropping of the corners of the mouth. If, however, you were to be able to differentiate that the eye was drooping as well, it would have been, it could be a key to a drooping one-sided paralysis face.
In which case you might look up a one-sided paralysis instead.
Go to face. One-sided. There we are, right there.
Okay. Let's see. A whole bunch of here's a good one from Lori. With so many invitations to examine physically, how do you advise lay homeopaths to proceed?
That's a great question. You know what I basically tell them? I think this goes to the questioning aspect of things, and I'd refer you back to the course I did on questioning. But one of the things that I ask of a mom, let's say mom is calling up and saying that one of their kids, little Jimmy, is really, really sick. One of the first questions, I think the key question that I would ask that mother, seeing as I'm unavailable, and this lady would then have to act as my surrogate in physically examining the case, I'd say, tell me everything you notice that draws your attention about Jimmy that isn't his usual self, that isn't his usual appearance, demeanor, behavior. Everything that looks and acts different from his usual healthy self. What do you really notice that way? And they'll instinctively tell you what they most obviously notice. And then, based on what kind of case it is, if it's a case of fever, I'll go ask them to touch the patient. What does the head feel like? What do the feet feel like? The hands feel like? Okay? I'll ask them to look at the eyes, look at the tongue. Is there any perspiration evident? What about the breath? And really, I'm only after what's obviously different from normal. That's all. And then I'll ask the question when we're finished. Out of all the stuff we've just been looking at, what is most different about Jimmy now that he's sick? Well, Jimmy's normally an up and at 'em, rough and tumble kid, and he's lying on that couch like a sleepy, lazy old dog. And of course, right away you think of Gelsemium. I hope that was helpful.
All right. So Lori has a good question here. What kinds of collapse other than stroke might point us to these remedies?
Any kind of collapse, any kind of sudden collapse that fits the state. It doesn't have to be a stroke. This is not as a matter of fact, this is not even exclusive. So if we go to the repertory here, we go to collapse. Here's a whole year's study for you, just in this rubric. This kind of collapse would fit any sudden weakness, any sudden unconsciousness. Doesn't have to be so sudden either. Sudden would be one of the sub-rubrics, right? Right here. But to truly understand, and this is a very important point, to truly understand the scope of the rubric, a dictionary definition of collapse does not suffice. The only thing that will give you a true idea of the scope of what is meant by collapse is to study the state described by each of these remedies. I would start with the remedies in the boldest type, then work to the second degree, and probably limit my study there. I'd go for the big remedies, the remedies in the, here's an arsenicum salt, that's the biggest. Then we have arsenicum, quina, ipecac, carbonium, carboveg, camphora, ammonium carbonicum, cicali. And then I might even go for the other ones, but that will give you a good idea. And that's a week's long study, but so worthwhile. We just did a few of these remedies in just a bit. That's how I began.
All right. I wanted to make a clarification. I apologize. I said 200 was the early bird special. It's 225. Someone just pointed that out to me. In fact, the regular price is 400, so it's 175 off. But that is 225, not 200. And again, that's through tomorrow. And so we have we're kind of featuring a new GoToWebinar feature this evening. I just uploaded Dr. Kellerstein's Word document. In your GoToWebinar control panel over on the right, if you open that up, if you've had it minimized, you'll need to open it up. It should have a handouts little blue bar that says handouts. And if you click on where it says firstaid-collapse.doc, you should be able to download that file, I believe.
That's
So
very
a new
cool.
feature. I've never used it before, so let me know if you have trouble with it. All right, here we go. There was a good question. I wanted to back up here and see. So Linda's wondering, how long after a stroke will our remedies work? Years, or is this just an acute case?
That's a fantastic question. So I'll throw the question right back at you, Linda. We don't know. As long as a dynamic symptom is present, as long as there's a good totality to shoot at, you fire. So we don't know how long after it might be useful. And in terms of the degree to which a remedy can help, if tissue is truly dead, necrotic, gone, then to the extent that something has died as a result of dead tissue, we cannot bring it back. But there's always that in-between phase where things appear as if they're highly impaired. And that can be traced to tissue that is perhaps injured, but not necessarily dying. There is the possibility of saving that tissue which is not totally dead. There are cases of stroke in the old literature with paralysis many years gone that did recover under homeopathy. But can we say for certainty that we could do that in each case? No, unfortunately we cannot. We don't have that kind of predictive capability in homeopathy, at least not yet, maybe in your generation. But as long as there's a totality to shoot at, there's hope. That's all I can say. That's why it's so important to take a good, complete case, to be accurate, and to track that totality with your remedies.
All right. It looks like everybody is having good luck downloading the handout. So if you haven't gotten it yet, go ahead and grab that Word doc before we're done here. We have a number of questions about potency and administration. So, one question came in after Dr. Herring's case where he, just had someone smell the remedy vial. Reasonable potencies to begin with and collapse, that sort of thing.
Okay. First of all, potency always needs to be individualized to the case at hand. The more acute, the more clear the symptomatology, the more aggressive the disease process, higher the potency. So Dr. Herring's case, what was the potency that he used?
I don't recall off the top of my head.
Well, it should have been somewhere on the order of a 10 or a 50M or a CM.
I was going to say 10, but...
Yeah, and you know what? He could have done it quite frequently. Now, for Herring, it was also quite fascinating. You notice, well, of course, for practical reasons, he couldn't do it during a seizure. It'd be kind of tough. But also, Hahnemann tells us that where possible, if there are paroxysms, if there's a paroxysmal or episodic kind of disease, it's best to give the remedy in the interim between paroxysms. So again, and that's exactly what he did by practical necessity. But yeah, the general rule is I'd start with somewhere between a 200 and a 1M in most acutes. And it's kind of like a gradient. The more clear the symptomatology, the more aggressive the possible nature of the disease, the higher the potency I use, and the more often I will repeat that potency as needed and indicated by the presenting picture. So if I've got somebody who is in a dire strait and I give them a dose of opium, whatever it might be, 200 1M, and I see that it's relapsing every half an hour, I'll start dosing every 10 minutes to keep that case going so that I get a nice clear curve of improvement. So I will dose as aggressively as is needed to make sure we assume a healing course. With acute diseases, your posology rather, I just wanted to say this correctly, your posology must be more aggressive than the force of the illness. Does that make sense? So if I had an illness that was very serious, very aggressive, and very obviously a remedy, I would give a high potency very often. And after the first few doses, I would judge the success of my posology by the response of the patient and adjust my posology accordingly.
And Geraldine is wondering if olfaction is as effective as an oral dose.
Sure it is. When I'm dealing with patients who are unconscious or post-op, because you can't give them pellets or drops, you can use either olfaction, or you can put a remedy in a water bottle, shake it up, and just gently moisten the mucous membrane of the mouth, so the inner surface of the lip. But no, olfaction can be very effective.
Did you need to cover anything else, Dr. Kellerstein?
No, I think I'm good. If there are no more questions, I'm good to go.
Yeah, I think we have pretty much covered them.
Wonderful. And I'd like to thank everybody for a great evening. And thank you so much for your questions. And above all, thank you for your responsiveness in those remedies. That was great. I think it's going to be a fantastic class.
We have one last question about the handout. I think that for people who have registered for the class, the handout will be on the course page. Tonight's freecast, of course, will be available on the Whole Health Now website, hopefully by tomorrow morning. But I imagine that the handout, because we don't really have a place on the freecast page to give out handouts, that will be available for people who actually register for the course. Take care, everyone. Have a good night. Dr. Kellerstein, thanks so much.
Hart, thank you so much. You were terrific, as always.
Thank you, sir. Take care.
Take care and good night.